Why are some STIs asymptomatic? Imagine living with an infection that quietly spreads without you even knowing. That's the reality for many people with sexually transmitted infections. Some STIs are asymptomatic because of how the pathogens involved behave and how they've evolved over time. When an infection causes noticeable symptoms, it can make the person seek treatment or change their behavior, which might limit how much the infection spreads. But if the infection causes no symptoms or very mild ones, the person might not realize they are infected and continue to have unprotected sex. This silent spread helps these infections persist and infect more people. Many STIs have phases where they are completely symptom-free. For example, bacteria like chlamydia and gonorrhea often cause no symptoms, especially in women. This can lead to delayed diagnosis and treatment because the person might not feel sick. Viral infections like herpes simplex virus and human papillomavirus also often stay hidden or cause only mild symptoms that go unnoticed. These infections can remain in the body for years, sometimes reactivating later without obvious signs. The reason some STIs stay asymptomatic comes down to a few key factors. First, the pathogens themselves are often adapted to infect mucosal surfaces, like the lining of the genitals, without triggering a strong immune response. This means they can hide without causing much tissue damage or inflammation that would produce symptoms. Second, from an evolutionary standpoint, it's advantageous for the pathogen if the infected person remains active and sexually active, spreading the infection without feeling sick. Less severe symptoms mean less chance of the person avoiding sexual activity or seeking treatment. Host factors also play a role. Differences in immune response, anatomy, and even sex can influence whether symptoms develop. For instance, women are more likely to have asymptomatic chlamydia or gonorrhea infections than men, which can make detection more challenging. Because many STIs are silent, people might unknowingly transmit infections to their partners, contributing to the high rates of STIs worldwide. This is why regular screening is so important, especially for those at higher risk, like sexually active young people or men who have sex with men. Routine testing helps catch infections early before they cause serious complications like infertility, pelvic inflammatory disease, or increase the risk of HIV transmission. In summary, the silent nature of many STIs is a result of biological and evolutionary factors that allow the infections to persist and spread without causing obvious symptoms. That's why staying informed, getting tested regularly, and talking openly with healthcare providers are essential steps to protect your sexual health.